Hello, everyone. Good evening. My name is Susan Reina Guerrero. I am President and CEO of Beacon Therapeutic. For the next 30 minutes, we'll be able to hear from Mary and some of the great work that's going on in the CHIPRA program. We represent Beacon Therapeutic. We're a non-for-profit located in the Beverly area. We've been around since 1968, and we really feel that we're making an impact and an influence on families and children here in Chicago, where we're creating new endings to disadvantaged beginnings. And we do this through a myriad of programs that we have, as well as various locations. This is a live call-in show, so if you have any questions or comments about what we're doing or what we're talking about, please feel free to give us a call. The number is 312-738-1060. I'd like to begin actually by going over our different locations. We are located in the Beverly area. We have 4 different locations. Our administrative offices are located on 1912 West 103rd. Our homeless services and the location for our CHIPRA program is 11740 Southwestern. We have our high school and our junior high school in Calumet Park. And our Longwood campus houses our elementary program and our intensive outpatient program. This is a listing of all of our programs, actually. We do have a therapeutic day school that goes K through 12. It's for children who need special education services and whose educational needs really exceed their local school's capacity. We have a shelter outreach services where we're providing mobile mental health services to homeless women and children throughout the city of Chicago. Today we'll be hearing about our CHIPRA program. We offer early Head Start programming, which is really targeting homeless young mothers who have children from birth to 3. We have a FACT program that's providing evidence-based programming for young mothers and their children, helping them become stably housed, as well as responding to their mental health needs and their child's development needs. We have a family homes program that's really targeting vulnerable families and quickly getting them housed and stable. We have a PATH program that works with mothers and adults, heads of household that have serious mental illness, and they need extensive supportive services to keep them housed. We have intensive outpatient programs that go from ages 5 all the way to age 12, where we're an alternative to inpatient programming, and essentially it's a myriad of developmentally appropriate programming various hours during the day to keep them in the community. And then we also have a regular outpatient mental health clinic. So that's enough about Beacon. I am here today with Mary Flores, who works with the CHIPRA program. So Mary, welcome and thank you for being here today.
Thanks for having me on your show.
So tell me a little bit about your background, Mary. How did you get involved with Beacon?
I'm a recent graduate from Governor State University. I received my bachelor's in social work. I always wanted to be a social worker, so I applied at Beacon and I was offered a job, and I was really excited because I'm able to help people receive benefits that maybe they don't know about.
So it's a great first job, it sounds like, because
Right.
it really gives you an exposure to some of the fundamental needs that vulnerable families have, vulnerable individuals have. So
Right.
we are talking today about CHIPRA, and I'm going to put an overhead on CHIPRA and what it is. And so CHIPRA stands for Children's Health Insurance Program Reauthorization Act. So as it's listed, it's an outreach program that's funded through a federal grant, and it's really targeting children and families and adolescents in Chicago who are without coverage. And so Marge Dunn's contact information is there. That's 773-233-3821, and she's the project lead, as I understand it. But Mary, tell me a little bit about what does CHIPRA mean? What does it actually do?
It's a health program that is under the state program All Kids, and we as case managers go out and help individuals fill out the applications for them to receive the benefits. And the reason we do that is because there are many barriers that maybe they're unable to go to the public aid office. So our program is good because we go to them. They don't have to come to us.
And when we're speaking of going to them, what kind of places are we going to find eligible individuals for this program?
Shelters, community centers. We go to families' homes and help them fill out the applications there. Wherever they want to meet us, we go.
Well, I know, and I'm going to put the picture up of Marge actually with the giant sheets that we take. And I do know one of the things that we talk about is that we're bringing the office to them. And, and what we're talking about, who is the them? Who is it that we're targeting? We're targeting children, right? So tell me a little bit about what's the eligibility criteria for the programs?
They have to For CHIPRA, it has to be 133% below poverty level. For all kids, the poverty level is a little bit lower than that. And what the thing with CHIPRA too is a lot of people don't know that they can be employed and still receive benefits. There's just a certain income level that they have to meet. And we go into teen shelters and help them get the all kids medical card too.
And what kind of benefits are covered under this? So, you mentioned there's CHIPRA and then there's all kids.
Mm-hmm.
So what's the difference? And I know there's another one, Illinois Family Care.
Right, all kids is from 0 to 19. CHIPRA, it covers families just as long as they're below the 133% poverty level. And the Family Health Network, I'm kind of new to this, so I'm not too sure how that one works. It's
another resource.
Right.
And I know, and that's an important distinction. So you're saying CHIPRA covers the whole family. So it can cover the head of household as well.
Yes.
It can cover that 2 heads of household, 1 head of household, and the children. And then all kids is specifically for the children.
It is, but if the parent is unemployed, they will be covered under that program too. And those programs, they cover health, medical, vision, and dental.
Okay. And in terms of, and I know last time we had somebody on from CHIPRA, there was the explanation in terms of documentation status and eligibility. For all kids, immigration status doesn't impact the eligibility.
For the children.
For the children.
If mom is here illegal and she doesn't have a social security number, she does not qualify, but her children will.
So anybody that is undocumented, is the adults are ineligible.
Yes.
But children's documentation status doesn't impact their ability to access these healthcare benefits.
Correct.
And I think that's one of the unique things that you bring to this team is that you do speak Spanish.
Yes.
And I know we're currently looking for someone that speaks Polish, or we're hoping to hire somebody who speaks Polish, because, individuals that are here, we know it's a very diverse group here in Chicago. So being able to deliver these resources in a language that's, that folks can understand is really important, particularly recognizing that all the children are eligible.
Yes.
Okay. So what's some of the process? How does someone become enrolled in this? What do they have to do?
We have to have a picture ID. If they have a social security number, social security card, or they have to at least know their social security number by heart. If they are employed, we need the last pay stub. If they're in a shelter and are unemployed, we need a letter from the shelter stating that they live there, along with their ID and social security number.
And so we gather all this information, and then I know there's a scanner or something, right?
Yes, we copy it on the scanner, and then we submit the application online, and then we fax all their documents to Springfield. And then we're just monitoring to see if their application was processed and if they're eligible or denied.
And how long does that process take from when the application is submitted to when you hear something back?
It takes, they say 30 to 45 days, but I've been finding that they're getting processed before 30 days.
Gosh, that's great.
Yes.
That's really important. I'd like to remind everyone this is a live call-in show, so if there's any questions or comments, please feel free to call. The number is 312-738-1060. My name is Susan Reyna Guerrero. I'm here from Beacon Therapeutic today with Mary Flores, and we're talking about the CHIPRA program. So Mary, tell me, so we're particularly targeting those folks that don't normally access traditional resources. So we're going into homeless shelters, homeless family shelters, or homeless teen shelters. And what are some of the barriers that those families face, and what makes it harder for them to go into the public aid office to apply for these things?
Sometimes it's transportation. They don't know, or maybe they don't have funds to pay for transportation, or the language barrier I'm finding. And
I would imagine, from what I know of teen homelessness, it's also the issues of them not wanting to be known where they are. Yes. So how does a teen get on these benefits if they've run away from home, let's say, and they don't want their parent to know where they are because they were fleeing a domestic violence situation or some kind of abusive situation? What is the option there for, let's say, an 18, 19-year-old? Can they still apply?
Yes, they can. Usually the shelter will contact us, and then we will go to the shelter and fill out the application with that individual.
And I think for teens, what would be most important is that then they're getting the medical resources they need to keep them healthy.
Yes.
And so then, as we know, we were talking a little bit earlier,
Mm.
I mean, some of the biggest challenges is seeing the teens.
Yes. Um, my experience is I feel kind of bad when I go into these teen shelters. I see them, they're trying to survive, and and they get happy and appreciative when they are eligible, and I come with their little gift bag, letting them know that they're eligible, and they're appreciative because now they can at least take care of their health.
And I know that's really important. I think
Yes.
they're vulnerable. They're out in the streets. They need to be able to take care of their health needs, which is crucially important.
Yes.
You mentioned gift bags.
Mm-hmm.
Tell me a little bit about that, because I know people always ask, how can they help Beacon? And I think this is one way people can
Right.
help. So tell me a little bit, what's in the gift bag?
Toiletries, mostly toiletries. I did see we had some socks, but mostly toiletries. But we do need more toiletries for males.
Because I think these are things that that we're using, I think is sometimes as a way of engagement, but also as a way of helping the folks that we're working with, because I
Right.
think this is really important. Now, I know Illinois has changed their re-enrollment process.
Mm-hmm.
Are you familiar with that process? And I know it's gone from an automatic re-enrollment to now people have to make sure that they follow up or something.
Yes, so now they're sending out one card a year. So once you receive that medical card, you have to make sure you hold on to it, because you will not be getting a monthly medical card anymore. And as I understand, before in the past, if you didn't go to your appointments, you would still automatically be enrolled with the All Kids or the medical card, but that no longer is happening. If you do not report in the year when your appointment comes up, then you will be dropped from the medical card.
And I think I could, on the surface, that sounds reasonable.
Yes.
I think from knowing from this very transient population, we're talking about homeless youth, homeless families, there's a lot of transition. They're moving around a lot.
Yes.
So if they don't get that notification, they will lose their benefits.
Correct.
So are there specific things that the CHIPRA team is doing to help the families make sure they don't fall off of the program like that?
Not specifically that I'm aware of, but most of the time the shelters know how to locate that family or that person. So we just call them and tell them we got this approval. And if the person is not at the shelter anymore, then they know how to contact that person.
And that is really important. I'm going to show some pictures right now of who it is that we're actually talking about. And I know you mentioned that we go into shelters and we go to centers. We also go into other like parks. I mean, can you describe some of the other places we've gone to?
Yeah, I've gone to community centers, schools, the seminars. I went to one this past Saturday on bullying through Proviso and Maywood.
Mm-hmm.
So we attend those kind of seminars and to put ourselves out there and let them know what kind of services we offer.
And I think, we're really emphasizing the importance of having children who are eligible for this service be able to access this service.
Yes.
And now, if you're a teen, do they count the parents' income?
Not if you're a teen in a shelter, we don't. But if you're a teen living at home, then we count the parents' income. But if you're a pregnant teen, then you would just apply on your own. And we would go by what you have.
What kind of services are covered for teens?
The same, medical, dental, vision, and I believe there's a few more services that are covered with the medical card, but I'm not aware of all of them. Those three are the main ones.
For the All Kids, and apparently the custodial parent has to complete the application. Is that because the children are younger children, so it's not the teens?
Yes. If it's a younger teen, then the parent has to fill out the application, and they would be the ones over that case.
Okay. What would you say are some of the biggest challenges in the work that you do?
I would think the biggest challenges is not being able to reach everyone. I'm sure there are a lot of individuals out there that need medical services, but they just don't know about them, or they don't know how to receive them, and it could be due to language barriers, or once again transportation. And I would think that would be the biggest barrier.
And I know when you mentioned, this the CHIPRA services, that can be employed parents and employed individuals, or they could be household income. Only it's not enough for them to be able to cover the insurance. Are there some special populations that you've come across that you were kind of surprised about?
Um, no, not. I can't mention. Can't think of any right now. So
I know, and I know you've been with the project not that
right,
long.
exactly.
But I do remember Marge, when she was on previously, talking about union employees, carpenters or pipe fitters or electricians, where they haven't had any work and they've had to really choose between paying their mortgage or paying their insurance benefits. So this benefit really isn't just for individuals in shelters. It's truly for anybody who's in need of health coverage, and they qualify. You mentioned 133%
3%.
of the poverty level. So do you have an average of how much that would be for a family like of four? I think I was remembering
Oh, I think it's like 2,000 and something.
a month, right, or
Right,
something.
a month, right.
So I think you can have a low income, or the working poor, as it were, and still be eligible for these resources. And I'm going to put the information on how to access these resources, because I think it is something that would be very important, that anybody that would be questioning even their eligibility, I'm sorry about that, would be questioning their eligibility, should contact us. If you are wondering whether you would qualify for these health benefits, it is important to just call us and we can check. And you can contact Marge Dunn, and the number is 773-233-3821, and that is Marge Dunn. And again, I think, it's always something that you can determine whether you're eligible for these resources or not. Clearly, all children in Illinois are eligible for all kids, but in these circumstances, then even individuals who are working, yet their income cannot support, them having the health insurance, this could also be of benefit to them.
Right.
What would you, have you had some shelters that you work with where there are more Spanish-speaking participants, so you've been able to use your Spanish, or how often have you been able to use your Spanish?
I think since I've started, I've met with 3 families that needed my assistance because they only spoke Spanish. But for the most part, they know English, the shelters that I go into.
And I know that's important. I would imagine the whole issue of the immigration status would be a problem, would be a worrisome issue for anybody who doesn't speak English, and maybe there is some question about that. But I think it is important to note that in Illinois, all children can be eligible for these benefits.
Yes.
And so you mentioned from when you apply to when you get notification, it's been less than, let's say, 30 days or
Yes.
so. And how do you keep track of that? Or how are you notified that the person is eligible?
The state will send us a letter plus the individual, but most of the time they say they never received their letter. But I myself, I do go in occasionally and log on and check to see where they're at with the application status.
And as I understand it, your capacity to log in, that's through through this project. Not everybody can do that.
Right, exactly.
Right. And I do know when we set up this initiative, that was something that was, because this is a federal program, we needed to develop all these linkage agreements with the Department of Public Aid and different city and state entities to make sure that we have access to these kinds of databases, which is different.
Yes.
That's how we're able to submit the applications on our own, because normally you can't. You have
Right,
to go through the
exactly.
office, right?
Exactly.
Do we also determine eligibility for other resources at the same time?
We can do SNAP benefits, which is the link, the food stamp.
Okay.
We can do that for the individual. And we can check to see where they're at with their application also. But our main job is we do the All Kids the Medical Card.
Do you find that the families that we work with have other needs as well, besides access to health care? I mean, do we look at, do they need mental health services? Or clearly if they're in homeless shelters, the housing is an issue for them as well. But do we identify other needs that these families may have?
I have gone into a shelter and I met with the young lady and we filled out her application, and I just felt like she needed other services. So I asked her if she didn't mind if I referred her to our FACT program. And she was very receptive. So I went back to the office and I gave them her information. And last I knew, I believe they were working with her.
Oh, that's great. And I think that's, if I may say so, I think that's one of the benefits of this project is that it really fits nicely into Beacon's array of programs where we recognize the importance of physical health as well as mental health, and then really looking at what are the developmental needs of the folks that we work with. So for our children, clearly their health is important, their physical health and their mental health, but also their developmental needs. So we have all these programs that kind of fit in there. It's just kind of knowing all of them. And you've only been with us for 6 months.
Right.
So do you think you got a sense of all the programs we have?
Yeah, kind of.
Because I think that's important to be able to make sure that we're referring folks to the right programs and so on.
Yes.
So at this type of work, it's not a regular 7 to 3 job, I would imagine.
No.
And I know in the summer, I know the CHIPRA team has done some of the summer picnics and those kinds of things. So do you sometimes work weekends or evenings or?
This past Saturday was my first weekend that I worked. But I have gone out to not Kankakee and Joliet, and sometimes it takes longer than it's supposed to, so I do go over my time.
Sure. Yeah, I would imagine so.
Right.
So, where do you see yourself, where would you like to see this project go within the next, couple of years?
We're waiting to hear from the new grant, so I hope it continues so we can continue to help individuals receive their health care insurance that they need, and hopefully with Obamacare there will be more programs like this to help them.
Well, I do know with the changes with healthcare reform, there are going to be many changes coming along the way, and I think this type of model is going to be one that's going to be helpful, as people need to negotiate and find resources for them and understand what it's all going to look like. This is going to be important, and if there's truly a commitment to making sure that families and children really get the health care that they need to keep them healthy, I could see the CHIPRA project really being instrumental in that.
Yes.
Okay. Any final thoughts or questions? We only have a couple of minutes left.
I hope that more people will reach out to us so that we can help them, and especially the Hispanic ones that have the language barrier. Just let them know that there is someone there to help them that speaks their language. And we will be hiring an individual that speaks Polish, so we'll be able hopefully to reach out to a different population also. That'll
be great. I'm actually going to put the contact information again for the CHIPRA initiative. And again, it's Marge Dunn, and the number is 773-233-3821. Thank you, Mary, for being on the show today. I'm actually going to put a couple of real quick things on that are coming up, some upcoming events. There you go. Okay, so if you want to get involved with Beacon and our great work, CHIPRA was one of the programs, please visit our website, www.beacon-therapeutic.org. We have our Home Run Inn pizza promotion that's May 2nd. A portion of any pizzas ordered from Home Run Inn will go to Beacon, and we're really excited. Of course, it's great pizza. It's the Skyline Plunge that I will be rappelling off a building May 5th. I am looking for sponsors and pledges, so please visit our website. That is on there. Beacon will be hosting the 14th Annual Breast Cancer Walk, May 12th. Our Ridge Run that we host, that goes in front of Beverly, is June 9th. Our Cycling Classic is July 18th. And our next big fundraiser is July 25th. It's called Beacon Bash, and it's Joe's on Wheat Street. And inevitably, we will be talking more about that as it gets closer. Again, Mary, thank you for joining us today.
Thanks for having me.
I hope folks found this interesting, and we will see everyone again next week. Thank you.
Thank you.